Now to an update on our Uncommitted series, where a federal judge is considering holding the state of Oregon in contempt for violating a long-standing court order over and over again. A contempt ruling could force fines against the state and potentially mandate changes to the state's flailing mental health system. Evan Watson joins us now after listening to the arguments in a two-day hearing that wrapped up today. Evan.
Yeah, Blair, that long-standing court order you mentioned says Oregon has to admit mentally ill defendants in jail who are unable to assist with their own legal defense to the state hospital within 7 days. And Oregon has failed repeatedly to comply with that over many years. There aren't enough mental health care beds, and people frequently languish in jail without proper treatment. A judge is now weighing her options: a contempt order, fines, forcing other actions and investment. There are a lot of people and organizations invested in this outcome, from Plaintiff Disability Rights Oregon and Defendant Oregon Health Authority to hospital systems, public defenders, mental health court judges, and district attorneys. Here's one example of the frustration over the state's inadequate mental health system from the Washington, Clackamas, and Marion County DAs. It is apparent that the only way the defendants will live up to their responsibility is for this court to find them in contempt and order without delay significant fines as a clear directive to adequately fund a mental health system with sufficient bed space and staffing at all levels. It's long past time that the blame game offered by the defendants instead of meaningful and attainable results comes to an end. For Disability Rights Oregon, hospital systems, public defenders, and more, the hope is that a contempt order and fines would force Oregon to make serious investments in a case like this, in its mental health care system, boosting capacity across the state, and then also in community restoration options. And there is some precedent here as well. In Washington, a 2018 contempt ruling for failing to provide mental health services to people in jail did spark investments and improvements. The state, Washington, paid about $200 million in fines for noncompliance in a similar case, and the legislature appropriated $90 million to purchase and renovate a previously closed behavioral health hospital. The state purchased that facility, got it up and running, and ultimately helped cut the number of people with mental illness waiting in jail from 500 to 15, meeting compliance standards that had been a problem for a decade. Now, the judge ended today's hearing without a ruling, saying that the issues have been presented clearly and she's taking them all into account and advisement. However, she did acknowledge that Oregon's legislature is currently in session, so there is a timeliness element to this, a clock ticking to enact meaningful and pressing change here.
So what is the plan if lawmakers approve funding, and especially if they don't? Yeah,
that is exactly what the judge asked the Oregon Health Authority, saying, hey, what if the funding doesn't come through? What is your plan there? And they answered that they'll work with that neutral expert in this case to try and ensure some of her recommendations are coming through. They continue on the path that they're doing, but the problem with that is the path that Oregon Health Authority has been taking has not been reaching compliance, and the judge seemed kind of frustrated with that response. So it'll be interesting to see what comes out here in the next couple of weeks, maybe, if she gives an order, and if it is contempt, if it is fine, if it is sanctions or other things, remedial actions to come out of that.
Well, we know you'll keep following this. Yeah. Evan Watson, thanks so much.
Thanks, Blair.